Right, thank you very much. Everybody, if you feel the need to, I won't be offended. People start shaking out their hands. Felt a little bit like writing an exam. Got a little quiet, although I will say you're a bit chatty if we were actually properly being examined. Great pleasure to be here with everyone today, and great pleasure to be on the stage with my friend Catherine. And I'm sure some of you will be wondering why these two firms are up sharing insights together. Not something we often see in industry events like this, and Catherine will elaborate on that a little bit. But maybe what I'll do is just start by introducing myself to those that I haven't had a chance to meet yet. My name is Matthew Norton. I'm a general manager at IQVIA Canada, and I have responsibility for 3 separate departments at a national level. So I have responsibility for our commercial consulting team, I have responsibility for our commercial technology team, and our public sector practice. And in fact, it's the public sector practice and that root of my professional origin is where I first had the opportunity to meet Catherine. I won't say how many years ago, because I think that would do both us an unkindness, but it's a little while, let's say.
Yeah.
So, Catherine?
Great, thank you. Yeah, Matt and I both share our roots in digital health and have both found our way to the pharma sector. I am so fortunate. I lead our consumer health and life sciences business at EY Canada, or Ernst & Young. I get that many of you would think, isn't that an accounting firm? What do you guys do and why are you together? But actually, we are a big global professional services firm. And the life sciences sector in the Americas is our second largest sector by volume of business, second only to financial services. And in fact, in our fiscal 23, it was a life sciences company who was our biggest client in the world. And so I hope that gives you an impression of our commitment to the sector. It's one that we are so proud and happy to be a part of. And so Matt and I saw a lot of opportunity and synergy in our various capabilities with, I know that IQVIA is well known to all of you with the depths of the data capabilities and analytics. And at EY, we approach our business with business transformation, strategic technology-enabled transformation. And we really saw an opportunity in this sector to come together, and we'll talk a little bit more about that as well.
Very good.
So what we're going to do this afternoon, and hey, there's benefits about going at 3:30, right? But there's some also other things that you go, shoot, that person just talked about exactly what we were going to talk about. But what we're going to try and do is weave together some of the threads from a lot of what we heard from the wonderful panels and speakers that we've had already throughout the day. I'm going to start off with a little bit of context setting. And then we're going to talk about launch. Launch is one thing that I don't think we've heard too much about today, but I think it's probably something that you are all thinking about and how best to use the data and what is the data telling us today. And then we'll go into more commercial aspects and omnichannel as well. So in terms of the trends, and I'll share with you what our firm has really defined as to be some global trends, almost all of which apply here in the Canadian market as well. That shift that we're seeing and pressures on the commercial aspects of our businesses, moving away from the big blockbuster drug to personalized medicines, huge emphasis on biologics, and it's really those areas, I'm sure many of you, these are all in your launch plans for the next 3 to 5 years or so, and that's where we're expecting to see the very large part of the growth, the very large growth, 60% of the growth around the world in launches will be in biologics and new modalities. Interestingly, in the past, the data is showing that new launches are underperforming since the pandemic. And Matt's going to talk a lot about that, in particular what the data says around that. But our research suggests that sales have been down in the first 6 months by approximately 19% compared to pre-pandemic benchmarks. This third area, the pressure on our health system, all of us, I'm assuming all of us, or the large majority of us in the room are Canadians. Honestly, you can't go a day without there being a story in the Globe and Mail, right? Like yesterday, it was about the role of pharmacists in community pharmacies, and we see governments across the country trying to do expanded role of pharmacists to ease the burden on access to primary care. It's so important. But then that causes challenges with other professions as well. And so there's so much going on, burnout and evolving scope of practice. But at the end of the day, this is all about improving access to care for Canadians. And we see this quite a bit. And people want to be engaged personally. I love the panel that we had this morning with all of the physicians talking about their desire for very personal engagement as well. And that, in many senses, coming back to, I need to use my time as the most efficiently as I can, and therefore I want my engagement to be very targeted to me. And that lends itself into the next one around evolving engagement strategies. How can we learn more about our customers to have very targeted engagement? So, how are we responding? What are we seeing around the world with respect to changing commercial strategies? Shift towards value-based care. Hugely important, really, especially in a single-payer system like we have here in Canada. We are very fortunate to be working with one of the big pharmas here in one of the provinces on a strategy for that. We're developing a proof of concept to see would this work with a certain technology-enabled tool that ingests a lot of the data and helps better inform value for money, contract compliance, all those sorts of things. I think we're going to start to see a lot more of this. We've talked about marketing and commercial communication functions, that need for agility, the rapid responsiveness to evolving customer needs, being able to tweak your campaigns, where you're putting your spend, ever evolving to demonstrate that value. And this is the first time I'm going to mention Gen AI, but there's a huge, huge opportunity there. It just tells us so much so quickly. And then lastly, tying back to my earlier point around the customer-centric engagements, I loved what Shaima, I think you're here. There you are. I see you in your lovely pink jacket. I said to her during the break that notion of the omnichannel being really able to bring things together rather than having multiple channels doing essentially the same thing, right? You want to know where you're getting your best bang for the buck, where you're getting the leverage, and I'll touch on that as well a little bit more. So, Matt, how are we doing?
We're good.
We're okay on
Yeah,
time?
timing's good.
Okay. So before I pass to Matt, at the end of the day, this is all about driving value. And for those of us who work in this sector, value can have so many different meanings, right? I think at our core and as Canadians, we really believe that value is best accrued to those receiving the healthcare services, and perhaps secondarily to the health system. But we also have our shareholders, our business interests. And so marrying up all of that by asking the right questions and defining your strategies and tactics to best answer those questions to drive value. So in your drug launches, how can you make those rapid adaptations to your launch plans when you're seeing the data and what that really means, and how are you going to get the best accelerated launch and bang for your buck? On the commercial, where are you delivering most value to your clients, responding to them in a way that is most meaningful for them? And how can you really identify all those various attributes within your multitude of channels to create the best omnichannel experience? And very closely tied to that is, I apologize, that's a bit messy there, is the digital marketing campaigns and just how people respond and what you're able to glean from all of that. So a bit of context setting. I'm going to pass to Matt now, who will talk some really great data about what we're seeing from launches.
Yeah. And so it wouldn't be an IQVIA presentation without some hot off the press data. So I figured we'd bring some information about launch performance in Canada. I want to pick up a couple of threads from what Catherine shared, both insights gleaned locally and gleaned globally. So you saw the comment earlier about the fact that launches have been underperforming at a global level since pre-pandemic periods. And that's a partial truth. And that's what this slide presents. So let me just walk people through what we're seeing on this particular chart. What you have at the bottom are the 12 months of each calendar year stacked from the 2017 to 2019 kind of baseline period as a comparison, and then the various years as we entered into, and then throughout the pandemic, and then the most recent data coming out of 23 and 24. And on the vertical, what you have is your average monthly sales. Monthly sales being an indication of how the industry as a whole is performing. And what becomes immediately clear, and we can see is happening in the marketplace, is we're actually at a very, very productive, a very, very enhanced area or enhanced market in the Canadian marketplace right now. And if we look at that 24 number up until May data month, the most recent data month we've got available for all new molecules being launched, it's on an accelerating curve and shows no sign of immediately declining. So one might think, okay, so why does the global trend say launches are somewhat depressed, and why even a year ago we would have said there's some issues in the market, and why do we talk so much about, okay, access to physicians is more difficult, the demand on their time is so high, how are we going to find alternate ways of delivering value and engaging with the marketplace in order to try and pull therapies from approval into market? Well, what you're seeing here and what's buried underneath the data is really a tale of two cities. And so, Catherine, if you can go to the next slide, it's fascinating what happens when we take the RSV and the GLP-1s out of the picture. So what you see in this particular chart is our overall launch productivity in Canada if we remove those two therapeutical areas, which are doing fantastically well. They are doing incredibly well right now. And what we see here, and just to make sure we're doing apples to apples, we pulled Ozempic out of the baseline numbers in the dark blue. We are currently in 24 trending along equivalent to where we were in pandemic periods. We are trending below where we were in 23. So for the bulk of the launches and the bulk of the companies active in market, we're still experiencing some sluggishness in the market in terms of our ability to bring therapy into the hands of Canadians and into the healthcare system as a whole. And I think it's important to reflect on that because it'll be somewhat easy to look at the very top line numbers and say, oh, everything's returned. But we have a deep understanding, many of you are still experiencing, our curve is not quite where we want it to be. We still need to adapt the ways in which we're working to bring therapy into market once we've got that approval to go. So, Catherine, maybe you could bring it forward. One of the interesting trends that my global colleagues and our global colleagues are identifying, again, hidden underneath that top line observation, is for 80% of the brands over the last 3 years, we're still seeing the old truism. Your first 6 months are going to really determine the trajectory of your overall financial performance. You're going to get past that 6 months and you'll still see some growth, but things will largely attenuate, and then you're going to be playing with the margins. But there are about 20% of brands who are classified amongst good performers who are hitting that peak well after the 6-month cycle, meaning they're finding an uptake 6 months after entry into a market. And it's those 20% of brands that are really, I think, revealing some of the same patterns and trends and the lessons that we've collectively heard from the various sessions this morning. Some of the things that we and our colleagues uncover when we ask companies who see this later pickup, what have you done differently? Why are you experiencing a pattern that seems a little bit outside the norm? And this is both a Canadian and a global set of questions and reflections. And you see on the right-hand side some of those paths to success. If we're a little sluggish out the gate, if the market is a little bit more difficult to move, how do we continue to accelerate? How do we continue to drive product into market? And what we see are some of the same lessons Catherine mentioned and some of the things that we've heard. These are companies that have the courage and the ability to adjust and sometimes fairly substantially adjust the plan post-launch. And that doesn't just mean adapt what we might get from global or adapt our understanding of the market, but that means even 3 months in, 4 months in, how do we make sometimes fairly substantial shifts in the way in which we're going to market in order to try and catch a tailwind? There are really, and this is a pervasive, this is both the traditional performers and the new performers, but those performers who seem to accelerate really demonstrate a significant commitment to digital and alternate ways of engaging with and delivering value, even when the healthcare practitioners we might want to be communicating with have their time so heavily constrained they cannot adopt quite as quickly as they might have 5 or 7 years ago. And then finally, I would reflect a little bit upon organizational agility and organizational governance and maturity, having that resiliency and the ability to adapt on the fly. We heard, I sat through the AI panel earlier, as I think many people did, and we heard about a lot of the change management lessons. Leander, I can see you in the room, you were talking about this. How do you have people bought in from the outset and then ready and able to adapt on a month-by-month basis when the evidence changes? And that, I think, is a core competency that is increasingly needed as we're living with a healthcare system that has a problem onboarding product. If we go to the next slide. So for those of you who are getting ready to launch product into the Canadian marketplace or just starting that process, this is a bit of a synthesis that the both of us have generated in terms of things to reflect upon and questions to ask oneself. Your strategic focus outlined on the left probably resonates with everybody here. We've got it. We've got a launch strategy. We've stress tested it with our understanding of the Canadian marketplace. We've got a tactical plan for our launch, and we've got our team revved up and ready to go. In order to try and either be part of the 80% that's going to hit that curve early and hit the curve the way you want it, or the ability to achieve later, I would encourage folks to reflect and honestly and critically ask yourselves questions. Is our launch strategy, does it have a complete and full understanding of the patient and the disease landscape? Do we have insights that came from global, and have they been fully and properly Canadianized? Again, we heard a ton about market access and pricing. I'm not going to beat that horse, but we've got to make sure that our strategies are robust and we've scenario planned out everything that we want to do there. Do we fully understand the competitive dynamics? Have we pressure tested them? Have we scenario planned what our competitors might be doing as we're entering into the market? And in particular on the go-to-market strategy front, have we got our omnichannel plans and our omnichannel infrastructure ready to go and in place? And have we thought both about the patient and HCP preferences? I had the chance to see Rivka speak earlier about the value that comes out of doing the kinds of patient ad boards that she was describing and getting really rich patient insights to be able to tune the way you're bringing value and message to the HCP and the patient communities. And then finally, I mentioned the piece on the competent and agile team. Can't stress enough the importance of agility, the importance of organizational resilience, and the ability to adapt on the fly. It's one thing to make a decision as a leader to say, oh, we got to turn left here. It's another thing for the rest of the organization to be able to turn left at the same time in a coordinated fashion. So I would ask everybody, reflect upon yourself. Is this, in fact, a fair characterization of where you think you are? Or are there things that you might want to reflect upon or double down on a little bit?
Okay, all right. So moving from launch then into the broader implementation and deployment of an omnichannel strategy. So I'm not going to spend too long on this slide because I actually thought you could explain this slide in so many different ways, and we saw so many great characteristics of this notion of, on the left-hand side, all of our discrete approaches to engage the customer, to the right-hand side, to a truly holistic omnichannel execution, where we are using different means with different messaging at different time based on our customers' experiences. But what we know is that our data unfortunately does not enable that rich understanding that we all want to get to. I'm sure you've all encountered a situation where you've said, well, we're spending X over here, Y over here, and Z over there. What should I continue to do? What should we rein back? Where should we continue to invest in our people? Which campaigns are working for us well and which are not? And so oftentimes what we're missing is the strong data foundation required to give us that insight. And so we're going to talk a little bit about the different foundational aspects of the data. First of all, putting the governance in place. This is very often a misstep, as we know. Who's accountable for what? Where does it reside? What are the permissions? What does identity access management look like? All of those sorts of things, making sure that it is accessible to those who need it and across various markets. Secondly, that capture. This is so important. You've got some great sources, not the least of which is IQVIA, but also your Viva CRM, the various tools that you're using. A lot of it is such subjective data as well that you need to make sure is being captured in the right way to give you those insights around your campaigns and other things. Frequency, granularity of that data capture, wanting to make sure that it's captured at the right time, whether it's the launch of a campaign, the timing of a visit with a physician, seasonality, time of year. What does it say that you're experiencing in October versus July, for example? Various data sets. We are very fortunate in Canada, I think, to benefit from a lot of information, the Canadian Institute of Health Information and other organizations as well that give us insights into our very rich and diverse geography, but incorporating that as well with your own internal data. I mentioned the campaigns as well, getting that data correctly around your content and the various mix that you have at any point in time. And then the last one, of course, being your costs. Do you have an accurate and meaningful way of capturing the costs of all of your various expenditures on channels? And how tightly can those costs be aligned to various initiatives? So I want to walk you through I admit, this is my favorite slide. I do love explaining it, so I hope I can make sense of it with you. This is a build, Matt. We were wondering if we had, okay.
No, there was a build.
So this is a tool that we've developed at EY, and it relies on IQVIA's data and also other sources that I just mentioned, your internal and your external data. It does account for seasonality, brand equity, all sorts of great things like that. And so what I want to draw your attention to, first of all, the x-axis. That's a pretty simple one. That's your number of interactions with your customers over time. And on the y-axis, it's the growth in sales. And you'll see quite easily that some of those curves start to show a saturation. So the more points of interaction that you have, the slower your growth in sales becomes. And so this is based on a tool that we've got that we call commercial mix modeling, and it's designed to show the effectiveness of your various channels. How can you tease those out? And so in this particular one, what it's showing you is that your face-to-face meetings and your remote meetings are your most effective. If you can see, their lines are progressing upward, but remote meetings have started to tap out a bit over time. That's started to be saturated. Where in this particular set of data, it's showing you that your emails from reps to your customers are not really accomplishing anything for you in terms of sales. So what we're able to do with this information is isolate for certain variables, as you can see here, but it also allows us to test different scenarios. What if I wanted to reduce my costs overall? What if I wanted to just focus on further investment in this particular channel? What would that help me do? So this is the types of things that we're seeing our clients wanting to be able to accomplish more of and helping to drive more value, both for the customer, because what it's telling you is what your customers really want to be receiving or how they want to be engaged, but also what's returning the most business impact to you. And so, Matt, back to you.
Yeah, and last couple of slides here. Mm-hmm. One of the other items that we've been working on, reflecting back on the slide Catherine just showed, was how do you begin to shift the trajectory of those curves? So it's one thing to understand and model them out and be able to answer the question your finance department might say, which is, where's my revenue or where are my sales coming from? Another is, how do I begin to adjust them? If I think they're flatter than they should be, how do I begin to move those trajectories? And part of that consists of what data are you using to power your omnichannel programs or campaigns, and how am I adjusting the timing and target of key messages or key points of engagement. So what this slide represents is essentially an adaptation of a tool that we built and launched in the United States for exactly that purpose about 3 years ago, and have just brought into the Canadian marketplace in the last couple of months. So what this does is use longitudinal data. So not the GPM or exponent data that many of you in the life sciences community might license from us, but rather use longitudinally linked patient information to begin to identify in the patients that are in a therapeutic area of interest to me, patterns that are emerging at different geographies, associated with different specialty types, associated with different physician groups, so that you can see week after week and month after month shifts that might be indicative of the fact that there's something happening in the patient population that's relevant for my therapy, and thus maybe I should decrease the time between engagements with that particular clinical team. Or maybe I should be engaging somebody I hadn't been engaging before because we see a cluster of potential patients that's relevant for the therapy. Now, some of this is going to sound a little bit similar if you've ever done consulting work with us before, because we've often done these kinds of studies as a study to inform your strategies and your tactics as you're going into the marketplace. The evolution here is our own progress as a company as we begin to take these algorithms, sometimes business rule driven, very often machine learning, and deploy them not once in the context of a project, but redeploy them on a weekly and monthly basis so they can become an incremental feed that might go into your marketing systems or into your CRM. So again, it becomes grist for the mill for next best action type solutions. It becomes grist for the mill as you're building and rebuilding segments of your digital segments or your omnichannel marketing segments. Anyway, we're very excited by it. We think it has the real potential to begin to shift the trajectories of those curves for companies that are looking not just to understand how do I reprioritize my investment, but how do I get more out of the investments that I'm making at the same time. So I'm going to conclude with just a couple of thoughts here, and hopefully we'll have time for a question or two if the audience has a couple of questions. A couple of thoughts, and this isn't just from our collective reflections in the marketplace. This is reflecting on everything we've been hearing today. And 4 key points. First off, the market dynamics are continuing to evolve in Canada. We've heard a lot about the stressors the healthcare system's under and the reality of launching into increasingly complex therapeutic areas, models, the rising role of the patient, the wellness community getting closer and closer into the therapeutic domain. This surfaces, to my perspective as a data geek, really exciting questions, but new questions, new and more complicated and challenging questions to answer. And a lot of these questions can't be answered in isolation. There's no one data set, there's no one technique that's going to answer everything you could possibly want to know about that particular set of realities. And so I think a lot of life sciences companies in particular are faced with a choice. One of those choices is we go and source data. We partner differently to get data available and moving. We go and ask the questions differently, and then my teams of 2 or 3 or 4 people try to stitch all the insights together to come up with something cohesive. The other option available, and Eric mentioned this when we were talking about generative AI, this is the build versus the buy option. The other option is go to the market differently, go to the vendor community or partner community differently, and ask them for something different. And I'll give a really practical example of what that means, and then we'll open it up for questions. Yep. So earlier this year, as Catherine and I were establishing kind of our collaborative presence in the marketplace, a bit of an interesting event happened. Again, we were earlier informing the kind of ideas and areas where we thought we could bring synergistic value, and we both received an RFP. We got an RFP from a customer who had a very strategic, very high-level corporate strategy type of a problem with an incredibly tight timeline. And the nature of the question was a whole bunch of data analytics, like really fast turnaround of really deep analytics, and some pretty serious engagement, both with the market and with the executive team around strategy, around prioritization, around decision-making. And because we've known each other so long and there's such a foundation of personal trust here as well as corporate respect and trust, Catherine and I kind of texted each other and said, just out of curiosity, did you get an RFP that kind of looks like this? What are you thinking? Without even divulging the name of the customer. And we both sort of said, well, I like half of it, but the other half is we can do it, but it's not in our wheelhouse. And so we independently, in following up with the client, sort of said, we love it, we understand the criticality, we understand the timeline. How do you feel about us responding together? And the client kind of responded independently, but to each of us in the same way. Never thought about that before. If it doesn't increase cost, then I'm interested. Not a surprising response. So put the challenge back on us to say, how do we bring the best of these 2 worlds together? And I was delighted to say they actually fast-tracked the RFP process, awarded us the work, and we were able to complete this entire exercise in like 6 weeks, which was incredibly fast-paced. Had we had to do the strategic work as IQVIA, it would have been almost undoable in that period of time. But we could do the analytics in 4.5, and vice versa.
Yeah.
And so I think that's a bit of an object lesson. It was a proof point to us that we're onto something, but I think it's an object lesson to at least a piece of advice that we would offer personally to the industry. Expect more from your vendors, expect your partners to show up differently, and demand more of them. And with that, there's 2 minutes left. So I don't know if people have questions. If not, we could sing a short Irish.
You can, maybe.
Are there any questions from the audience? Maybe we would ask you, how does that last message resonate? The idea of asking your partner community to show up differently, sort of asking for more collaboration from them. This is exactly what you're looking for at a panel. Deathly silence. Yeah, please.
Yeah.
Thanks a lot for the presentation. It was one of the most insightful presentations
thank
today.
you.
And I learned a lot. I can relate with a lot of things that shared today. To your point, it's something that in an ideal world is great to be seen from both vendors and the client side on both sides. But the issue that I've seen most of the times is that we're getting to this discussion very late, to the point that we don't even have that 6 weeks that you mentioned. We want the data like yesterday in most of the cases. As a matter of fact, as you were presenting this new LRX data, which was the first time for me hearing about this, and looks fantastic, I asked myself, do you have this data available retrospectively? For example, if I come to you and say, for example, for neurology, do you have this data for the past 3 years?
Yeah.
And that's the way of thinking. And now that you're asking these questions, I'm talking about myself. Most of the times, I'm getting to this point very late, when I need the data right now. Otherwise, I don't have time to wait for it. Or maybe my leadership team that doesn't have time for it.
Yeah. A completely fair set of reflections. And I really appreciated your comment as well about thinking retrospectively, and everything we've heard today is faster and future focused, right? And so one of the things, I think collectively as a very smart group of individuals in a fairly large room, one of the challenges we can all ask of ourselves is we need to be stretching our thinking a little bit, and sometimes asking a different question rather than asking the question we're habituated to ask. Hey, can you give me some LRX data? Can you give me some of this data? Can we do a strategic engagement? Ask instead, here's the problem I'm trying to solve, or here's the problem set I'm facing. How do we go after it? And what that does is, again, it expects more out of your partner community to show up differently and say, oh, that's creative. What if we did this? What if we did this? What if we did this? And it starts to, I think, create potentially something with unique or new value. And with that, I know we're now at time.
Yeah.
So.
Amazing. Thank you so much.
Thank you.
Big applause for Catherine and Matthew. Thank you so very much. That was great.
Thank you.